New data reveals that men are dying at nearly twice the rate of women from coronavirus. And Dr. Matthew Rettig joins us live. He is the principal investigator of a clinical trial underway at UCLA. First, thank you for joining us, but give us your full title if you can.
Yeah, hi, I'm Dr. Matthew Rettig. I'm a medical oncologist, and I'm the chief of hematology oncology at the VA in West Los Angeles, and I'm a professor of medicine and urology at UCLA and the UCLA Johnson Comprehensive Cancer Center.
You're one busy man. Just wanted to make sure we got that in for our viewers. The first question for you, what are the main differences for men and women with coronavirus?
So it appears that men suffer more severe illness due to COVID-19, the coronavirus, than women. And that's been seen not only in the United States, but across the globe, where men are dying 2 to 3 times more frequently than women.
So, doctor, why is it harder for men to recover?
Well, we have some insight into the underlying explanation for this difference in the case fatality rate. We think it's related to the sex hormones, specifically male hormones like testosterone, which are of course higher in men than they are in women.
Okay, so are they more likely to be affected?
So it's not clear that they're necessarily more likely to be infected, but the severity of the illness is much greater in men than in women. And we have a pretty good understanding of why men seem to be suffering more from the disease than women. Male hormones actually regulate a key receptor that the virus uses to gain entry into cells, including the cells that line the lungs. So what we know is that the virus is a parasite, and parasites need to get into their host to survive, and in the case of the virus, to proliferate and cause damage to lung tissue and other organs. Well, the virus has a spike, a little spike protein that it uses as kind of a key to open the door to get into the lung cells.
Oh my.
That key, yes, the key actually regulates a protein called TMPRSS2. And that TMPRSS2, when it's unlocked by the virus, allows the virus to get into the lung cells. And importantly, that TMPRSS2 receptor, that lock, is expressed or induced by male hormones. So the idea is that if we can suppress male hormones, we can actually prevent virus from getting into lung cells in the first place.
This is alarming here. Let's talk about your new clinical trial. How are you hoping to help men infected with COVID-19?
Yeah, the clinical trial is called the HITCH study, and that's the acronym for the study that is using temporary suppression of male hormones in men who are admitted to VA hospitals due to severe COVID-19 illness. And the study is what we call a double-blind study. So the patients get either the real drug or a placebo. Actually, the ratio of men who get the real drug is 2 to 1 patient getting placebo. So twice as many men will get the real drug as opposed to the placebo.
So, doctor, what are the initial findings of the trial so far?
So far, we're just getting underway, and we don't have clinical results yet. We're hoping to execute the trial very rapidly and complete it within 90 days. The VA has been very nimble in getting a study open. This kind of study typically takes 10 to 12 months to open, but in the current environment, VA has expedited the various regulatory approvals that have allowed us to get this study up and running.
All right, and a final question for you. How can the public help with this study?
Well, I think it's important, one, that if you have a friend or family member who is a veteran and has COVID-19, they can access the study through the VA Medical Center in West Los Angeles.
All right, Dr. Rettig.
Thank you very much.
No, keep going. You were about to say something more importantly?
Yeah, so importantly, I don't want people to go out there and start taking medications that may regulate the male hormones. We really need to do the scientific study first and establish whether or not the drug can actually help patients with severe COVID-19.
All right, glad you got that point across. Thank you so much for joining us. We appreciate it, and you're always welcome back.